Anyone who has ever spent time in a hospital or who has experience in healthcare knows how common it is for patients to have an IV placed and its role in providing vital care to the patient. Gaining and maintaining IV access is essential because it allows the nurse or healthcare provider to quickly, easily, and effectively administer intravenous therapy, including medication, nutrition, and fluids. Our business, called innovatIVe, has created a solution to this clinical obstacle. We have designed a device which consists of two layers. The first layer involves a skin-colored sleeve that will be applied to the patient's arm or wrist, paired with a breathable dome. A clasp would secure the dome and cover the IV site, protecting it from the patient, but allowing necessary access to the healthcare professional. The following layer would provide extra security to the device by utilizing a proximity sensor to notify a member of the patient's care team if this layer were to be compromised. The intravenous catheter insertion procedure can be intimidating for many patients, especially geriatric or psychiatric patients. It can result in fear or anxiety, which may lead a patient to intentionally attempt to remove their IV. Unintended and unscheduled removal of an intravenous catheter can be very dangerous without the supervision and expertise of healthcare personnel. It can also be detrimental to care because the patient is no longer able to receive potentially life-saving medications and fluids, and it may be tough to place another line at a new site while trying to reassure an apprehensive or agitated patient. This procedure is not enjoyable for any patient population, but can be especially traumatizing for specific populations, such as geriatric and psychiatric patients. For example, some physical and mental changes associated with the aging process, such as decrease in skin elasticity and muscle composition, as well as increased incidence of confusion and delirium, can lead to a negative experience for the older population. Similarly, some of the medications that are commonly used in psychiatric settings can cause an individual to be apprehensive or even violent towards treatment. These are just two examples of patients who may be negatively affected by the untimely removal of an intravenous catheter. In many clinical settings, restraints tend to be the first course of action when faced with a combative or delusional patient. However, it has been proven through evidence-based practice that restraints often have a negative effect on the patient, not only physically, but mentally and emotionally. innovatIVe's unique device will be the first of its kind on the market to address the issues of dislodgements of intravenous catheters. Utilizing a skin-colored sleeve prevents it from attracting the attention of the patient. As we continue to develop new iterations of our device, we plan to incorporate different skin-colored sleeves to promote inclusivity within all patient populations. This serves as a small stepping stone that will hopefully lead to a more inclusive healthcare system. Additionally, we plan to offer the sleeve in a wide range of sizes, similar to existing blood pressure cuffs, with adjustability and elasticity to ensure the fit is secure. Our device aims to increase the amount of time and dexterity it takes for a patient to successfully remove their IV. The mission of innovatIVe is to improve overall patient care by ensuring intravenous therapy can be administered and decreasing the need for restraints in hospital settings. This would proactively shorten hospital stays by decreasing the incidence of these events. We believe that our device will make nurses and other healthcare providers' lives easier and increase the quality of life for patients who are predisposed to the intentional or accidental removal of their IV. On a larger scale, we hope that our proposed solution could improve efficiency of hospital staff and prevent the waste of valuable and costly hospital resources, such as IV tubing, medications, and fluids.